All right, so this is obviously a cow heart. Okay.
It's not a cat?
I'm going to use this to just show you some of the external features. First, you need to know front and back, otherwise everything else gets screwed up, okay? So you look for this diagonal line here. Okay, that's the ventral sulcus. That's on the front side of the heart. And in that groove is where the major coronary vessels are that feed the heart muscle itself. The apex of the pointy part, that's the bottom of the left ventricle. So all of this is left ventricle. All of this is right ventricle. Okay, the upper chambers, hold on to this thing. This is the left atrium here. This is the right atrium back here, the flaps.
They're also called auricles, right?
Yeah.
Okay.
You just call them atria, that's fine.
All right, I know I got that right on the quiz at least.
Okay. Major vessels. There's a major vessel that lays right across the front of the heart, right here, kind of horizontally across the top. This is the pulmonary artery. Remember, arteries carry blood away from the heart. So this is the pulmonary artery, so this is taking blood
Away from...
to, where's it going?
Lungs.
To the lungs, right? Pulmonary means lungs, okay? So this is taking that oxygen poor blood back out to the lungs. Right, to dump the CO2, pick up the O2, okay? So that's the pulmonary artery. Straight up and down, the biggest one you're going to see right there. This thing is huge in the cow. That's the aorta, okay? You can feel it. It's thick, but it's pretty elastic, right? Because your arteries are under pressure, so they have to stretch. So they're very elastic. If they don't stretch, if you have hardening of the arteries, that's a bad thing. So that's going to increase pressure if it can't stretch, and then you can rupture things, and that's just no good, okay? So this is the aorta. So the aorta, you know, comes up from the heart, makes kind of a U-turn, and then goes down behind the heart and follows the spine all the way down the body. The first branch off the aorta, before it makes that big U right there, that's the Brachiocephalic Artery. So that's going to come up and that's going to branch left and right for the arms, right? Brachii is arms, okay? And then there's branches that go up to the head too. We'll talk about that next week. But that first branch is the Brachiocephalic. Okay? The veins come into the heart on the back, so I'm going to turn the heart around here. The largest vein in the body is this one right here. It's enormous in the cow, apparently. It's huge. Okay? This would be the superior vena cava coming down, draining the head and the four limbs of the cow. Okay? And the inferior branch will be coming up, and I don't know if I can poke this all the way through here without poking holes in something. The inferior branch will be coming up from the bottom, right? Bringing blood, that oxygen poor blood, from the trunk and the limbs back up to the heart. And both that superior and inferior vena cava are going to dump into the right atrium, right there. Okay, so if I turn it around, see, now we're on the back, that's the right atrium. So the superior and inferior vena cava dump that oxygen poor blood in the right side. Okay, the right side always gets the oxygen poor blood. Okay, so we send the blood out to the lungs, gas exchange happens, right? You exhale the CO2, you absorb all the O2, and now that oxygen-rich blood is going to come back to the left side of the heart. Through this opening here, there's actually should be several pulmonary veins coming back here, but it's just cut really close. So they all come back here, and that's going to dump all that oxygen-rich blood now into the left atria. Okay? All right. So now, let's orient ourselves on a somewhat smaller scale. So here's the sheep heart. Again, here's the sulcus. So this is the front. There's the apex. That's the bottom of the left. So all of this is left. This is right ventricle. This is left atrium. This is right atrium. Yep. This is what's left. Not much. This is what's left of the pulmonary artery across the top and the front. Okay. And straight up and down, there's the aorta on the top. Okay. And then this is the first branch off of the aorta right there. That would be the brachiocephalic. Okay. Coming back to the heart, if I can find them. Here we go. Actually, there we go. So on the back, on the right side on the back, again, the superior vena cava, the inferior vena cava. Okay, and then they're both going to come back and they're going to dump blood right into that right atrium. Okay? All of those pulmonary veins, again, this has been cut too close, but all those pulmonary veins come right there on the back on the left side, right? And that's going to dump that oxygen-rich blood now into the left atria. Okay? All right, and then if we do some internal anatomy, so I'm now going to open up the heart here. Okay? So all of this, again, here's the point, right? So this is the bottom of the left ventricle. All of this is ventricle. This is the right, this is the left. What you can notice first off is there's much less myocardium, muscle on the right compared to the left. That's because the right needs less muscle, because that's just going to contract with enough force to send blood to the lungs. Whereas the left has to contract with a lot of force to send blood through that aorta around the whole body. Okay? And it tells you in your lab to look for the different layers of cardiac tissue, cardiac muscle, but it all just looks like gray goo to me. So if they put something in here, you're just going to call it myocardium, because that's what most of it is anyway. Okay? So it's all just myocardium. Okay, so if we look, if I open this up, this is the right atrium. You see all those extra ridges and bumps and things in there? That's muscle. That's called pectinate muscle, because the upper chambers have to contract too, right? So that's pectinate muscle. And now that right atrium is going to contract and send the blood to the right ventricle, but to get there we have to go through a valve, because there are valves that separate the upper chambers from the lower chambers. They're cuspid valves. Okay, a cusp is a flap of tissue. This is a cusp, right? A flap of tissue. Okay? Those cusps, in turn, are anchored by the heartstrings. Those are the chordae tendineae, or tiny tendons. And those are attached to this muscle right here, which is papillary muscle on the wall of the ventricle. Okay, so when that papillary muscle contracts, it's going to pull on those heartstrings, those chordae tendineae, that's where it comes from, right? The chordae tendineae, and that's going to close the valve.
When you pulled on my chordae tendineae.
When that muscle relaxes, the tension is released, and then the valve opens. Okay? So this is a tricuspid or three-part valve on the right, the chordae tendineae, the papillary muscle. Okay? Similarly, on the left, there's not much left of the left atrium up here. Actually, I don't think can't get into anything up here. Okay, so here's the inside again of the left atrium. Can you see that in there? It's not cut too well. Right, up here. So that's, again, pectinate muscle on the inside of the atrium. Now the atrium contracts and sends blood to the ventricle, but again, we have to go through a valve. On the left side, it's just a two-part valve, a bicuspid valve. Again, here's the cusp, or the big flap of tissue. And the chordae tendineae down in there. Can you see that? And those are anchored to really big papillary muscle. Okay. In addition to that, on the wall down here, you see these extra ridges on the wall of the ventricle on the bottom there? Can we see that? That's extra muscle in the left. That's called the trabeculae carnae muscle. And again, that's all to give enough force to get the blood up and around through the body. Okay? So again, we have the bicuspid, the chordae tendineae, papillary muscle, trabeculae carnae muscle in there. You see that, hon? All the ridges in the bottom here? All right. So now when that ventricle contracts, it's going to send that left ventricle with all that nice oxygen-rich blood, it's going to contract and send it through the aorta and around the body. But there are also valves between the ventricles and the vessels leaving the heart. So here's the aorta right here, in this particular heart. And this is coming right from that. Hold on. Let's do it this way. So here's the aorta. And let's see if we can find the aortic. Oh yeah, it's right there. Okay. So again, this is the left side. And this is the aorta. But to get out, we have to go past these flaps of tissue right here. And I don't know where the other one is. Anyway, right there, there's these little flaps of tissue that just kind of open and close, open and close. Those are semilunar valves, and this is right at the beginning of the aorta. So this is the aortic semilunar valve. Okay, so once that heart contracts and pushes the blood up through the aorta, this valve closes to prevent the blood from coming back down. Okay, my husband actually had to have this valve removed because it was defective. So he was getting blood constantly coming back down into the left ventricle, which was enlarging the left side of his heart. So they went in and they cut that out, and they put in this thing that's about the size of a $50, this ring, and the outer part of the ring is covered with Dacron, these Dacron fibers, and inside is just a little flapper thing. and they sewed that in, and then the heart muscle actually grows into the dacron to hold it in place. So he doesn't do the whole lub dub anymore. He does a tick tock. He literally ticks,
Really?
which is really kind of annoying if you're sitting on the couch next to him and it's really quiet. Tick, tick, tick. So
That's crazy.
yeah, that's the aortic semilunar valve there. Then there's also a valve in the pulmonary artery. I can show you that on this sheet part because I cut this one open. So there's a valve between the right ventricle and the pulmonary artery coming out, and that's the pulmonary semilunar valve. But to see that, we kind of have to go in on the outside here and pull this way down. And you can see right down there, way deep, you see those flaps of tissue in there? Right down in there? See those? You see them in there? Yeah, they're really big. Flaps of tissue. That's the pulmonary semilunar valve. That's to keep blood from coming back into the right side. Okay? One other thing I want to show you on this thing is something particular to the sheep and the cow. If we look in this is the right ventricle. If you look down here in the right ventricle, you're going to see this thing that looks like a rubber band in there. See that?
Moderator band, right?
That's the moderator band. I don't know what it does, but they like to clip on that and ask you what it is, so now you know. Okay? I don't know what it does.
That's it. That was
That's
like
it.
a 2000 flip phone.